parasympathetic as well as the secretomotor, that is a general visceral efferent innervation of the glands. So the parasympathetic secretomotor innervation of the glands. This is the topic we are going to see. So the questions are, in case of the lacrimal gland, so what is it carried by? So which nerve is involved here? What is it carried by? Next question is, in case of the submandibular gland as well as the sublingual gland. So in case of the submandibular gland and the sublingual gland, what are the formation? How is it formed? Next, we see the question is, in case of the parotid gland. In case of the parotid gland, what is the course of the parotid gland? So we'll find out these answers in this video. So firstly, we need to know that the nervus intermedius is also called the nerve of Würzburg. So it is nothing but a sensory as well as the secretomotor component, and this is nothing but of the facial nerve. Next, what we see is the main trunk. So the main trunk of the facial nerve, as it exits the brainstem, it carries only motor fibers. So they are some important points to note. So now moving on, looking at the lacrimal gland. So in case of the lacrimal gland, the nucleus is the lacrimal nucleus as well as the pons. Now, how is it carried by? It is carried by the nervus intermedius, that is a facial nerve. It is nothing but 7. Now looking at the nerve, the nerve is nothing but the greater superficial petrosal nerve. Now we look at the formation. So formation is nothing but, it is the branches. It branches at the first genu and the geniculate ganglion. Now, how does it exit the middle ear? So middle ear exit is through the facial hiatus. Then, what is the course of the lacrimal gland? The course is that first it traverses in the middle cranial fossa. It traverses in middle cranial fossa. So what we saw is, first it travels in the middle cranial fossa. So it travels in the middle cranial fossa floor. Then it exits through the foramen. It exits through the foramen lacerum. And what it does is, it joins deep petrosal. It joins the deep petrosal nerve. And this takes place in the foramen lacerum. Now looking at the further course. So in terms of the further course, it forms the nerve of the pterygoid canal as well as the Vidian nerve. Now looking at the ganglion. So ganglion is that there is a pterygopalatine ganglion. Now what is this supplied by? So looking at the supplied, it is supplied by nothing but the lacrimal branch of the ophthalmic division, that is the V1 of the trigeminal nerve. Next we move on to the next gland, that is the submandibular gland. Submandibular gland or the sublingual gland. So here the nucleus is nothing but superior salivary. So superior salivary nucleus as well as the pons. So what is it carried by? So it is carried by the nervus intermedius facial nerve. It is carried by the nervus intermedius facial nerve. Next, what is a nerve? The nerve involved is the chorda tympani. So how is it formed? The formation is by it branches in the vertical segment. Next, how does it exit the middle ear through? So exiting the middle ear is by the pterygotympanic, that is a petrotympanic fissure. The petrotympanic fissure or the canal of Hughes. Now we are looking at the course, is that it enters the infratemporal fossa. So it enters the infratemporal fossa, and what it does, it joins the lingual nerve. Next, what is a ganglion which is involved? So the ganglion involved here in case of the submandibular gland, so ganglion is the submandibular ganglion. Next we look at the parotid glands. The parotid glands. So here the nucleus is nothing but the inferior salivary nucleus and also the pons. So this is carried by the glossopharyngeal nerve. So it is nothing but 9. And now looking at the nerve. The nerve is the lesser petrosal nerve. So what is the formation? So how is it formed? So formation. So if you look at the formation, it is formed over the promontory. It is formed over the promontory from the tympanic plexus. Next, what we see is how does it exit the middle ear? So exiting the middle ear is through the hiatus. It is through the hiatus for the lesser petrosal nerve. Now we look at the course. So what is the course? The course is that it travels on the floor of the middle cranial fossa. And how is the exit? It exits through via the foramen ovale. So exit is through the foramen ovale. Now looking at the further course. So further course is that it enters the infratemporal fossa. Now looking at the ganglion. The ganglion here is nothing but the otic ganglion. So what is this supplied by? So the supply is by the auriculotemporal branch. So auriculotemporal branch, this is of the mandibular nerve, that is nothing but V, that is phi 3. So now to answer our questions, the first question we asked was in terms of the lacrimal gland. In terms of the lacrimal gland, what is it carried by? Lacrimal gland is carried by the nervus intermedius facial nerve. Next question was, how is the formation of the submandibular sublingual gland? How is the formation? So the formation is by, it branches in the vertical segment. So that is how the formation is done. Next question was, in case of the parotid gland. So in case of the parotid gland, what is the course? So firstly, it travels on the floor. It travels on the floor and of the middle cranial fossa. Floor of the middle cranial fossa. So as soon as it travels to the middle cranial fossa, then it exits. Where does it exit from? It exits from the foramen via the foramen ovale. So exit is from the foramen ovale.